Hey YouTube, my name is Dr. Daniel Kaplan, and my mission is to bring psychology to all and make it accessible for all who want it. In this video, we're going to talk about separation anxiety disorder, and we will learn about the features of separation anxiety disorder. We'll learn how frequently it occurs, and then we'll talk about some treatments for separation anxiety disorder. And that is our video in a nutshell. So if you like what you hear and you find the content meaningful, hit the like button, subscribe, click the notifications tab, because that will allow this video to move to a larger audience and will allow you to know when another video has been released. So without further ado, here we go. So a good place to start is the acknowledgement that some anxiety is perfectly normal and is a common part of childhood. So if we were to look at some research by Mary Ainsworth and look at the strange room or strange situations study, there is a natural reaction for young children to have anxiety in the presence of a new person, which is called stranger anxiety. And it is natural for a child to have separation anxiety, which is when their loved one, their parent or caregiver, is no longer present, to have some anxiety around their departure. And separation anxiety in a normal sense hits its peak around 2 years old, but it starts to subside. And what we're going to talk about is eventually when that anxiety is still present, but should have subsided. But as I said, some anxiety is normal and it's a healthy, common part of childhood. And the world can oftentimes seem new and scary because many children don't have the same knowledge and experience as adults have. We also know that when parents have their own anxieties or problems or inadequacies, that can be superimposed on a child, and that child will have to reconcile the feelings that they're uh, absorbing, or it's called introjection from a psychoanalytic point of view. They're absorbing the experience of the world around them. And we know that some children are more prone to an anxious temperament than others. So we'll get into that. So now let's talk about the disorder. Separation anxiety disorder, the assumption is that the child should have mastered the ability to be away from their parent or caregiver. So if we see a developmentally inappropriate or excessive fear or anxiety related to separation, parents or caregivers coming and going, then that's a red flag. And then we have to look at what symptoms, what are the manifestations of that anxiety. If you have three of the following in criterion A, that brings you towards the diagnosis. So recurrent or excessive distress when anticipating or experiencing separation from home or a major attachment figure. So the anxiety of, oh, I'm going to be dropped off at school, I might start to feel uncomfortable even before we leave the home, right? I might feel even more uncomfortable when the car gets pulled up in front of the school. So these kind of distress or anxiety that occurs as a function of separation is a hallmark feature. You can also see persistent worry about losing an attachment figure, such as losing them to injury, illness, disaster, death, things like that. You can also see worry about unexpected or untoward events, such as maybe being kidnapped or getting lost or becoming ill, which would cause a separation from this attachment figure. We also see reluctance or refusal to go out or leave the home, to go to work, school, etc. Now, it's interesting, the language of work. We're talking about this as a childhood disorder, but that doesn't mean that separation anxiety disorder cannot persist into adulthood. So, not being able to leave one's house and do what they need to do. You could also see some excessive fear or reluctance about being alone or not having major attachment figures in the home or in other settings. You might also see anxiety or refusal to sleep away from the home. So we tend to see people with separation anxiety disorder struggle. They absolutely struggle with sleepovers and things like that because they're not going to be near to their caregiver. We also see that it affects their sleep. There are nightmares about separation and a lot of the other anxiety symptoms, the somatic symptoms you start to see, things like headaches, stomach aches, nausea, vomiting. These start to occur in anticipation of that separation. So, of the previous two slides, you need a minimum of three criteria. You don't need all of them, you need three. Now, we also have a duration criterion for children and adolescents under the age of 18 to meet this criteria. You only need 4 weeks, 4 weeks of having this disrupted anxiety, fear of separation is sufficient. But in adulthood, it's a chronic condition, so we need 6 months or longer. We also see that separation anxiety disorder causes dysfunction or impairs social functioning, academic, occupational functions, and so forth. And we also need to rule out other mental conditions that could mirror separation anxiety disorder. So things like autism spectrum disorders, they might have some separation anxiety, but it's not better explained by separation anxiety disorder. It's better explained by autism. So those are the criterion to meet the diagnosis. In terms of the frequency of the diagnosis, we see that it's roughly anywhere between 4 to 10% of all children display separation anxiety disorder features. The average is roughly around 4% internationally, and we see that it's equally common amongst boys and girls. And if it were to occur in adulthood, the frequency is much less, anywhere between 0.9 to 1.9%. So there's extreme anxiety, there are panic features anytime this child is separated from their home or their parent. Or in the case of an adult, it could occur when you're separated from your romantic partner or things of that nature. So this is separation anxiety disorder. This is the frequency by which it occurs. But I mentioned this is a form of a childhood disorder. And in fact, of all the anxiety disorders, separation anxiety disorder has the earliest onset. You're able to detect it earliest from all of the childhood conditions related to anxiety. And the reasoning is because if you're going to a preschool or you're going to kindergarten, it's going to manifest frequently as school refusal. So we also want to appreciate cultural factors that might influence the diagnosis. Different cultures value separation to greater or lesser degrees. So if you're in an individualistic society, there is more of a push for separation, which creates more acceptance among children around separation. Whereas other societies, more collectivistic societies, they value more of an interdependence among family members. And that interdependence might come with some resistance or lower tolerance to being away from the family. So we have to be very careful that these factors of separation and independence play a role, and that fluctuates from society to society. So make sure that even within that society, this is considered atypical in order that you're not over pathologizing someone who comes from a collectivistic society. Now, what are some of the risk factors? Well, risk factors include, and this is not an all exhaustive list, there are many other factors. Uh, a loss or a life stressor that results in separation. If you've experienced the death of a loved one, whether it's a grandparent or a pet, or in some cases, divorce and separation, where you're no longer able to interact with both parents to the same degree, that could induce separation anxiety. That is a risk factor for it. We also know that there are certain temperaments, certain people are more anxiety prone than others. And there is a genetic component. So if you have a blood relative who has anxiety or an anxiety disorder, you're at a greater risk to have separation anxiety disorder. And then, of course, there are environmental factors, things like natural disasters, earthquakes, whatnot, that could induce separation anxiety. And this one is, another major one, especially in adulthood. So if you experience an earthquake and the community is in ruins and you haven't been able to find your loved one, that could carry with you into the future where you might develop a separation anxiety disorder. Now, treatments. There are tons of treatments, but cognitive behavioral therapy is one of the primary treatments used. And one of the goals of cognitive behavioral therapy is to help a person identify, recognize their anxiety, and learn how to master it and overcome it in social situations or situations where they might actually have to separate from a loved one. Medicine is not the first line treatment for separation anxiety disorder. It is there, but I think it's important that we try other forms of therapy first. But medication, things like antidepressant medication or anti-anxiety medication, might, depending on the severity of the school refusal, might be able to help the child along to cope with their anxiety while they're learning cognitive skills. We also know that family therapy is important because parents play a critical role in treatment. Children don't usually have control over their schedules, the interactions, whoever they're with or whatnot. And then, of course, because in childhood, a school, might have to get involved if the kid's not coming to school. So you might have a school social worker or a guidance counselor involved in helping the child return to the school setting and get comfortable. So that is, from soup to nuts, separation anxiety disorder. So as a recap, separation anxiety disorder is a very common disorder in childhood, but it can persist into adulthood. We know that roughly about 4% internationally, kids develop separation anxiety disorder. And it comes with a whole host of dysfunction, whether it be school, friendships, sleepovers, things like that, that a kid may struggle with. And as an adult, it might be struggles with one's romantic partner. We also discussed some of the risk factors that predispose or increase the odds of a person developing separation anxiety disorder, and we concluded with a few treatments. So, once again, I hope this video was valuable. I hope that you learned at least one new thing, and I hope that it permeates YouTube. So, if you like the video, if you found it useful, hit the like button, subscribe, click the notifications tab. As I mentioned, it's very important to bringing this video to a larger audience. So I thank you very much for your time. Until next time, people.